Hello everyone, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working in Bangalore. Yes, very much they are one of the most common causes for frequent sinus infections. Besides blocking your nostrils, the polyps are also grow into the nooks and corners of the nose, which will have the openings of the other non-involved sinuses. So, if the non-involved sinuses entrances are blocked, the mucus that is secreted on a day to day will get collected inside and they can get infected. That means there will be sudden exaggerations of the nose block, headaches, that can happen if the other sinuses are also getting involved. And eventually that is also infection is also another inflammatory process. So those sinuses also can get involved in the polypoidal changes. So yes, nasal polyps will cause sinus infections repeatedly. So the recovery after nasal polyp surgery is not a major this thing. Like any other nasal surgery, you are there in the hospital for about 2 days. Maybe there is a nasal packing done where we'll place some sponge or cotton or such material into the nostril to keep like a dressing. Like any wound, any surgery, we do a dressing. So like that, inside the nasal cavity there will be a dressing or nasal pack which will be typically removed after about 36 to 48 hours and then you are sent home. Now the first week is important that you stay home and prevent exposure to any other source of infection or exposure to any excessive dust. So we advise to stay home for that week because of course you are preventing secondary infections on the wounds, and also there will be a lot of mucus secretions as a response to the surgery injury, and there will be some blood clots which are collected inside the sinuses. There may be some small bleeding that can happen. So the nostrils will be congested and blocked with the congestion of the tissues as a response to the injury. You will have mucus dried up forming crusts, you will have clots drying up and blocking the nostrils. So these things will make it uncomfortable for you to do anything productively outside. You will be having nasal drops, saline washes, you will have medications to take on a routine. So about a week altogether post surgery you are staying home. You will be called usually for a revisit in the OPD where we will do a cleaning, where we will try to remove as much of clots and mucus, crusts, everything possible. Then the nose starts opening up better. From then on, 1 week post surgery you can start going to the office. Even during the 1 week you are at home, if you are up to it, you can even if you have the facility of working from home, you can work from home. Only thing, we wouldn't suggest to go outside, get yourself exposed to infection or dust and pollution. Like any nasal surgery, there will be some antibiotics, there will be some painkillers obviously. Not that the pain is going to be too much, but yes, we do cover the first few days when the body starts recovering. So painkillers will be there, nasal decongestants will be there, tablets will be there. There will be some nose drops which will help in decongesting, opening up nostrils better, and also these drops will help in loosening those crusts and clots so that the nose can start getting cleared up. You don't want the mucus crusts or the clots to get pent up inside and get infected. So obviously there will be nose drops, and then maybe saline washes also can be started within few days post surgery. Otherwise nothing much. We would want you to stay home and take the medications, keep the nostrils gently cleaned regularly, and that should be this thing. Nothing major about the post operative care in the polyp surgery. Nasal sprays and their effectiveness in the reduction in size of the polyps. Yes, nasal sprays are always a part of nasal polyp treatment whether you undergo surgery or not, right? They are basically mostly steroid based medications which will be sprayed directly into the nose. So these steroids are well known anti-inflammatory, that they are the best anti-inflammatory medications. So like I said, the basis of polyps is some inflammation going on in the nose or sinuses. So if you try to control the inflammation, whether it is allergic or infective, then the polyps can shrink. And so obviously a smaller polyp will respond to nasal sprays and control of allergy better, or if there is a combination of antibiotics in case of sinus infections, decongestants and nasal sprays together could reduce the size of polyps significantly, because you are also dealing with the primary issue, right? And otherwise by themselves they don't do a great job of reducing, especially medium or large size in the normal setup.